Today I've seen a very interesting demonstration of peer training program, which I think is vital because I think for a lot of people, the idea of administering a medicine, they think in terms of that being done by people who are paramedics or other, clinically qualified folk. The truth is that the administration of naloxone can be delivered by, and don't have to be professionally qualified to do so, and indeed may actually be better dealt with by people who are in the community. And therefore the training that's being delivered here is being delivered by the peers of those who are getting the training. It isn't a magic solution, and I think people that talk about naloxone as if it is, that's a dangerous way to go. This is one aspect of a whole set of interventions that are needed if we're actually going to make big inroads into the drug problem in Scotland.
The importance of the peer training is that we actually manage to take it out into the communities and speak to people in a language that they understand. A lot of them don't associate with professional people, so we give them the ABCs in simple terms. What naloxone is, what it does, gets rid of all the myths and the barriers about social work involvement, prescriptions being cut, professionals taking a vested interest in them just because they carry naloxone. That's not what it's about. Naloxone is about giving it to them to help save their lives, or making people aware that they carry naloxone and it can be used on them to save their own life.
Last year we had our highest ever number of drug-related deaths at 584 people who lost their lives. Drug users and their friends and families are 9 times out of 10 the first responders. So that's why it's so important that we make this the norm, so that if you attend a service and you have a history of opiate use, or you're currently using opiates, and that includes opiate replacement therapy, you should be afforded naloxone. Just as straightforward as somebody with asthma is given inhalers, or somebody with who suffers from anaphylactic reactions is given epinephrine. That's how naloxone should be normalised.
It's of huge importance because ultimately it's being administered in circumstances where the likely alternative is going to be death. So you are pulling people back at the 11th hour. Therefore, it's extremely important from our perspective that as many people not just have access to naloxone, but even greater numbers of people have access to the training that allows them to administer it in those circumstances. So rather than panicking, they are able to actually take some constructive action. And it needs to be made very clear to people that this is about buying time, because it doesn't mean that you don't then have to have very fast, very serious emergency medical intervention, but it gives you the time to get that intervention into place.